A very good evening, distinguished guests, ladies and gentlemen. It gives me great pleasure to welcome all of you this evening to the ceremonial inauguration of the Médecins Sans Frontières MSF Scientific Days Asia, an international conference on medical sciences 2022 here in Colombo, Sri Lanka. To commence the evening's proceedings, may I kindly request all of you to rise to receive the ceremonial procession. Please remain standing for the university anthem.
Sri Lanka Pinbar Randirani Srinivasa Maha Aganagare Sri Jayavardhana Pura Sarasari Sri Namaya Randhavam Lomudune Kaduwe Siri Sumagul Samidun
Deli Vitiye Sorat Bandu Yatilun
Vigikala Vidyodaya Vidu Bimalun Eliyen Divi Magasarasau Sri Lanka Pindar Randirani Srinivasa Maha Aganagare Sri Jayavardhana Pura Sarasari Sri Namaya Randhavam Lomudune Ayuktiyedi Vivadashili
Asatyayedi Vicharashili
Viyak Sabhamed Samajashili Diyatun Nidaya Pogalau Sri Lanka Pindar Randirani Srinivasa Maha Aganagare Sri Jayavardhana Pura Sarasari Sri Namaya Randhavam Lomudune Vidya Uppatatan Setta Patatan Setta Nijau Patatan Setta
Next, we would like to enlighten this evening with the blissful light of the lamp of learning. On behalf of the Research Committee of the Faculty of Medical Sciences, let me invite the following dignitaries to come forward for the lighting of the traditional oil lamp. Senior Professor Sudanta Liyanage, the Vice Chancellor of the University of Sri Jayawardhanapura. Senior Professor Aloka Patirana, Dean of the Faculty of Medical Sciences. Professor Shirantha Heenkanda, Dean of the Faculty of Humanities and Social Sciences. Professor Upul Subasinghe, Dean of the Faculty of Applied Sciences. Professor P.D. Nimal, Dean of the Faculty of Management Studies and Commerce. Dr. Tilakasiri Bandara, Dean of the Faculty of Engineering. Dr. Nalaka Lankasena, the Acting Dean of the Faculty of Technology. Professor M.D.J. Vijay Bandara, Acting Dean of the Faculty of Allied Health Sciences. Senior Professor Pradeep M. Jaivira, Dean of the Faculty of Urban and Aquatic Bioresources. Senior Professor Yasavardhana, Dean of the Faculty of Dental Sciences. Orator tonight, Professor Chandani Vanigatunga. Deputy Registrar of the Faculty of Medical Sciences, Mrs. Varanika Amaratunga. Acting Librarian, Dr. G.D.M.N. Samaradivakara. And on behalf of the Research Committee, Dr. Varuni Thennakon, Chairperson of the Research Committee, Dr. Nilanka Pereira, the Secretary of the Research Committee, Dr. Tushari Disanayaka, the Conference Secretary, representing Médecins Sans Frontières, Doctors Without Borders, I would like to invite Helen O'Neill, the Strategic Advisor to the MSF South Asia, Dr. Vismarajaj Srivastava, Strategic Medical Lead, MSF South Asia, Ms. Akshanka Aurora, Executive Manager, MSF South Asia. I would like to invite Senior Professor M.M. Patmalao, Dean of the Faculty of Graduate Studies, Mr. Sachin Singh, the Director Fundraising, representing MSF South Asia, Thank you, ladies and gentlemen. You may now take your seats. May I now invite the following dignitaries to take your seats at the head table. Senior Professor Sudanta Liyanage, the Vice Chancellor. Senior Professor Aloka Pathirana, the Dean of the Faculty of Medical Sciences. Professor Chandani Vanigatunga, the Orator. Dr. Varuni Thennakon, Chairperson of the Research Committee. Dr. Nilanka Pereira, Secretary of the Research Committee. Thank you very much. Ladies and gentlemen, it gives me great pleasure to invite the chairperson of the Research Committee, Dr. Varuni Thennakon, to deliver the welcome address.
Senior Professor Sudanta Liyanage, Senior Professor Aloka Pajirana, the MSF team, Professor Chandani Wanigatunga, the orator for the evening, distinguished invitees, my dear colleagues, ladies and gentlemen. A grateful evening to all of you. It is indeed my pleasure to warmly welcome you all to the inaugural ceremony of the MSF Asia Scientific Days and the International Conference on Medical Sciences 2022. John Bardeen, the only person to be awarded the Nobel Prize in Physics twice, once said, I quote, "Science is a field which grows continuously with ever-expanding frontiers." I unquote. This year, we have a collaboration with Mediso Frontiers and esteemed international humanitarian organization which largely support research, innovation, and development to have this joint scientific session at the Faculty of Medical Sciences. So, I wish to begin by thanking the team from MSF for the respected collaboration and coming all the way to Sri Lanka to be with us tonight, despite many obstacles. So, please join me with a special round of applause to the MSF and the team. The focal drive of this joint conference is to bring professionals together across the globe to exchange ideas and approaches, to showcase innovations with state-of-the-art technologies, and to bridge gaps in research and medicine towards best practices. It is nothing short of extraordinary to see how many of you all are here and to imagine what you do when you aren't here and the kind of impact that brings to the public. The vibrant scientific program we have for tomorrow is encompassed with a wide range of interesting and stimulative topics, and we will stream it live online. If I may take you briefly through the tomorrow program, the keynote address will be delivered by Dr. Maria Guerra from Switzerland. There will be 2 symposia, one on advances in clinical medicine and healthcare, and the other on keeping children safe together, by local expertise in relevant fields. There will be 2 panel discussions, one on non-communicable diseases and the other on climate crisis and disease burden. The eminent speakers that would share their knowledge would be Dr. Khalida Aslam and Dr. Rob Emin from Bangladesh, Dr. Saifur Rahman from Ireland, Dr. Adil Nacham from USA, Dr. Purnima Prabhakaran from India, and Dr. Nalika Gunawardena and Professor Nilika Malavige from Sri Lanka. The free oral communications in tomorrow's program represent high-impact research findings from around the world. In addition, there will be more than 80 e-poster presentations displayed at the site. So, I hope all of us will make the most of it tomorrow and I extend my heartfelt appreciations to all prolific international and national experts for taking part in this conference. I warmly congratulate Professor Chandani Vanikatunga, the orator tonight, and deeply appreciate her pivotal work and esteemed research, which is acknowledged today with the award of the prestigious Faculty of Medical Sciences Oration 2022. Ladies and gentlemen, the success of a conference of this magnitude would not be possible without the relentless work of many. I wouldn't do a formal vote of thanks, but I would like to extend my utmost gratitude to all those who supported us, from the Vice Chancellor, the Dean of the Faculty, the MSF, all service providers, and all academic and non-academic staff. And especially Nilanka, for all those long calls, late night Zoom meetings, and for the excellent coordination. Thank you. I'm very happy to see you all and wish you a very productive conference with exciting and encouraging discussions and a good time networking with each other in hours to come. Thank you and have a pleasant evening.
Thank you, Madam. Next, I would like to extend my invitation to Senior Professor Aloka Pathirana, the Dean of the Faculty of Medical Sciences, to address the gathering.
Vice Chancellor, Senior Professor Sudanta Liyanage, who is the chief guest today, Dr. Farhad Mantu, who is Executive Director, South Asia of the Medicine Sans Frontiers, Deans of the faculties, Professor Chandani Vanitunga, our orator today, distinguished guests, my colleagues, ladies and gentlemen. It gives me great pleasure to welcome all of you to the Research Conference 2022 of our faculty. As the Dean, I am very proud and happy to see the enthusiasm shown by the organizing teams of our faculty and the MSF with whom we are collaborating this year. Our faculty was established in the year 1993 as the 6th medical faculty in the country. We had our inaugural research sessions 4 years after the commencement, that is in 1997. Thereafter, we had regular annual sessions with a few interruptions until 2018. That was when the sessions were upgraded to an international research conference. And this year we are conducting the 4th of its kind. Research, as we know, is an integral component of the medical profession. We depend heavily on our research for our day-to-day practice to make correct decisions which will benefit our patients. Our faculty comprises of academics who are in the forefront of medical research in the country, and many have worldwide recognition. This year, our university was ranked the 3rd among the Sri Lankan universities according to the Webometrics ranking, which emphasizes on the effectiveness of the research output of a university. I am certain that our faculty made a significant contribution to this rank elevation, considering the relatively high research output of our university. We have taken many steps to ensure that our undergraduates get the necessary understanding not only to conduct meaningful research, but also to give them ample opportunities to get involved in practically performing research. All these efforts need a platform to present, and this conference is an ideal event for this. We all thought that we had a very difficult time during the COVID pandemic 2 years ago, and we were compelled to hold our conference last year fully online. We were expecting things to improve with time, with the reduction in numbers of COVID patients. But the economic disaster which followed the pandemic was unprecedented. Budget restrictions, fuel limitations were accompanied by regular power interruptions. Sometimes I wonder how we manage. These presented us with many challenges which were unpredictable and challenging all the time. It demonstrated amply two of the three signata of Buddhism, anicca and dukkha, impermanence and unhappiness. I think our resilience has improved with all these challenges. New ideas and innovations are coming up. I am happy that we have been able to conduct all our activities with minimal interruptions despite all the challenges we have faced up to now. The determination to hold this conference as a hybrid event resulted in coming up with not one, but many fallback options. Having the MSF to join us for a collaborative event elevated the status of the conference to a level which was not seen before. The MSF team, just like us, were very keen to have a high-quality meeting. They were kind enough to shoulder the financial burden of the scientific sessions, which would have been a tough ask for us if we were able to do it on our own, considering the financial status of the country and the university, both. We are happy that we did not cause much of a financial burden to the university due to this collaboration. We did not, I must say, depend on any outside sponsor for this event. About the conference, as Varuni mentioned, we have many oral presentations, symposia, panel discussions, and also a keynote address this year. The participation has been widespread this time with presenters from other universities in the country and from several other countries. We are proud to have one of our own academic members, Professor Chandani Vanigatunga, delivering the oration this year. I am certain that the participants this year would gain from the knowledge shared and our collaboration with the MSF would be strengthened. We sincerely hope that our bond with the MSF would result in many mutually beneficial activities other than this research session. New funding for research has been curtailed this year, as we know. This would certainly hamper research activities in the near future, and my sincere hope, and I'm sure my colleagues would share my sentiments, is that research, which is one of the most important pillars a success of a university is dependent upon, is restored as soon as the country's situation starts to improve. I'm sure our Vice Chancellor, who graced this occasion despite serious family commitments, would ensure this. I must thank our team, led by Drs. Varuni Teneko, Nilanka Pereira, and the research committee who worked tirelessly, and the MSF team for not giving up and coming up with a dazzling program, despite difficulties we faced. I wish you all the very best for a fruitful meeting. Thank you.
Thank you very much, sir, for your inspiring and very encouraging words. It is now my honor to invite the chief guest of the night, Senior Professor Sudhantha Liyanage, the Vice Chancellor of the University of Sri Jayawardhanapura, to address the gathering. Over to you, sir.
Ayubowan and very good evening, all of you. Dean, Faculty of Medical Sciences, and the fellow deans of other faculties, Research Committee Chairman and her group, orator, Professor Chandani Vanigatunga, other colleagues at the other faculties at the university, and Professor Vajira Disanayaka, Chairman SLMC, all invitees and well-wishers. As a Vice Chancellor, I am very happy today. Due to some reason, MSF has selected to collaborate with our Faculty of Medical Sciences to organize International Conference on Medical Sciences 2022. That indicates the strength of our Faculty of Medical Sciences. It was established about good 30 years ago, but now we are basically in par with most of very well-established medical faculties in Sri Lanka. And especially doing research is a very important thing. We all know we are now experiencing the thing called the new normal condition. The new normal, under this new normal condition, most of the things we have enjoyed under normal condition are not having with us. Especially the country like Sri Lanka, in addition to the COVID-19 pandemic issue, we are experiencing some economic problems or the crisis. Usually, we say, if you have a crisis, that basically born leaders, or that give leaders. So as a researcher, as a person, you have to rethink about that particular statement, whether Sri Lanka, we got new leaders, or the leaders born due to the crisis are better than the previous ones. So that another challenging thing you have to think. So it says the Doctors Without Borders, that indicate, so everybody has to network each other. The one good thing happened to Sri Lanka because of this COVID pandemic thing. We start, especially the higher education sector, establish very good programs for the education sector. Most of the things are online education. So when we are dealing with online education, of course, the Doctors Without Borders definitely going to be there, because if anybody from anywhere can network with us. So earlier, normally, especially in Sri Lanka, we really want to see everybody physically presenting, even in our classes, in all conferences, in all other functions. But though the person is not physically available, their thinking, their ideas can be discussed with other people or other colleagues. So therefore, I think today's event also going to be a very fruitful and a very good event, because so many people are connecting via Zoom, maybe, I don't know, the most of the people tomorrow and a day after tomorrow. So that's an encouraging factor. And also, I think under the new normal condition, the medical science field has faced a lot of challenges. Now even today, we are talking about the new wave of COVID-19, but though we say it's not that strong, maybe a fairly weak strain is available in these days. In addition to that, the monkeypox new disease we are discussing, and also the other diseases, especially the dengue and all, also basically available these days in Sri Lanka. So therefore, I think as a university academics and as a doctor, if you are doing research, that's an extremely important thing. What we are experiencing or what we are expecting from a researcher is to develop their analytical thinking. When you have a problem, so that then you may end up with many solutions, we should be able to select the best solution among the many solutions available. That is the most important thing. Because always we are facing for challenges. Of course, these days we are having many challenges. But even under the normal condition also, we had a lot of challenges. But I am very happy to see most of our academics at the Faculty of Medical Sciences, not at University of Sri Jayawardenepura, in all medical faculties, so they are working very hard. Even in almost all universities, except the University of Moratuwa, the Faculty of Medical Science academics are doing better research. And they publish a lot of journal papers. So that helping our universities to increase our ranking in the webometric ranking or other ranking system. So as Professor Aloka mentioned, now our ranking in the world ranking system also slowly increasing. So if I have analyzed that particular situation, what is happening with our university, your faculty is contributing a lot for this particular ranking thing. Because earlier, the most of the Sri Lankan universities considered as teaching universities. We have not spent money. We have not spent much time to develop our own research. But due to some changes in our education sector. Now I think we are helping all our researchers to do better research. So with that small note, I congratulate the research committee of Faculty of Medical Sciences and Professor Varuni Tennakon and her team organizing this particular event in a much better way, and all the researchers who have basically submitted their research papers to this particular conference. If I correct, you all have received more than 100 papers, so out of which you have selected about 60 papers for the posters. The balance you all are going to discuss with your peers and other colleagues and people. So once you discuss all your findings with your colleagues, I think you and the colleagues may give you a good constructive criticisms about your research, so then you can develop further. So thank you very much for inviting me as the chief guest. Earlier in the morning today, I thought definitely I'm going to miss this particular event. Somehow I managed the time, and but please excuse me, I am leaving very soon from this research inaugural session due to my personal commitments. And again, I hope that the coming 2 days going to be very, very fruitful and enjoyable day for all the medical science people in this country. Thank you very much.
Thank you very much, sir, for your valuable words and for being present here tonight despite your very busy schedule. We really appreciate it. Ladies and gentlemen, next is the highlight of tonight's program, the Faculty of Medical Sciences Oration 2022. I would now like to invite Senior Professor Aloka Pathirana to introduce Professor Chandani Vanigatunga, the orator of the evening, to this esteemed audience and award the Orator's Medal.
Professor Chandani Amila Vanigatunga ni Subasingha, MBBS Honours in CMC, MD Colombo, FCCP, FRCP Edinburgh, and FRCP. Professor Chandani Vanigatunga, who had her primary and secondary education at Visakha Vidyalaya, Colombo, graduated with second-class honours in 1992 from the North Colombo Medical College with distinctions in microbiology, parasitology, and medicine. She obtained the MD Medicine Colombo in 2000 and was board certified as a specialist physician in internal medicine in 2002 by the Postgraduate Institute of Medicine, University of Colombo. She is a fellow of the Ceylon College of Physicians, Royal College of Physicians of Edinburgh, and Royal College of Physicians of London. Professor Vanigatunga joined the faculty in 1995 and is currently the chair and professor of pharmacology of the faculty, University of Sri Jayawardenepura. She has served as a senior lecturer in clinical medicine and a visiting lecturer in pharmacology from 2012 to 2015 at the South Asian Institute of Technology and Medicine, and as a physician in the University Anticoagulation Clinic at the Colombo South Teaching Hospital. She is a postgraduate trainer and an examiner for the Postgraduate Institute of Medicine, University of Colombo, and is a member of its specialty board in clinical pharmacology. She was the president of the Ceylon College of Physicians in 2019 and is the current chairperson of both the Ethics Review Committee of the Sri Lanka Medical Association and the Forum for Ethics Review Committees in Sri Lanka. She has served as a member and as a secretary for the Sri Lanka Association of Clinical Pharmacology and Therapeutics and for the Sri Lanka Clinical Trials Registry. Professor Vanigatunga has also rendered her expertise in a number of committees at national level, including several committees in the Ministry of Health, Sri Lanka Association for the Advancement of Science, and the National Science Foundation. Her contributions at international level are in the field of ethics, and she is an international surveyor of the SIDS, or Strategic Initiative for Developing Capacity in Ethical Review program, of FERCAP to accredit ethics review committees in Asia and the Western Pacific region. She has been a resource person for training workshops on surveying and evaluating ethics review committees in Chennai, Beijing, Mangalore, Mumbai, and Bangkok over the past years. Professor Vanikatunga has generously given her expertise in the editorial work for the Journal of the Ceylon College of Physicians and the BMJ Therapeutics and the ADRs. She serves as an able reviewer for several national and international journals such as Drugs and Aging, PLOS Global Public Health, Wellcome Open Research and Postgraduate Medical Journal. Ladies and gentlemen, at the Faculty of Medical Sciences, University of Sri Jawadanapura, Professor Vanikatunga was instrumental in obtaining the SIDSA recognition for the Ethics Review Committee of the faculty in 2012 and re-recognition in 2015. She was also an active member in a number of ERC task force committees, Secretary of the Staff Development Committee, and was the President of the Faculty of Medical Sciences Teachers Association in 2011. She has liberally shared her passion in photography with the student body, being the staff advisor for the Nature and Photographic Society of the Faculty of Medical Sciences from 2012 to 2015. Professor Vanikatunga is a reputed researcher. Her interests in research largely span over the fields of drug prescribing in the elderly, rational use of antibiotics, and warfarin management in anticoagulation. There are 12 published books or book chapters authored by her as a sole author or as joint publications. To her credit, she has authored 36 full papers in peer-reviewed journals. The list of her research abstract publications goes on for several pages. She has supervised many postgraduate and undergraduate research projects and has trained scientists producing 2 PhDs and an MPhil. Professor Vanikatunga has continued to be involved in disseminating knowledge to fellow students, medical officers and general practitioners, pharmacists and other paramedics and patients. She has been a resource person for many workshops and an invited speaker in several forums, including inaugural Belt and Road International Diabetics Forum, China. During her career as a researcher, she has claimed several prestigious awards, to name a few: President's Award for the Scientific Publications in 2014 and 2015, Award for Supervision of Postgraduate Degrees in 2015 and 2017, National Research Council Merit Award for Scientific Publications in 2018, E.M. Vijayarama Award for the Best Presentation at the Young Physicians Forum in 2001, and Dr. Henry Rajaratnam Award for the Best Paper in Endocrinology in 2016. It is a seminal work and well-regarded research that is recognized tonight with the award of the prestigious Faculty of Medical Sciences Oration 2022. Ladies and gentlemen, it is my pleasure now to invite Professor Chandani Vanikatunga to accept the Orator's Medal and to deliver the Faculty of Medical Sciences Oration 2022.
Thank you very much, Aloka, for that very generous introduction. Chief guest, Senior Professor Sudhanta Liyanage, Vice Chancellor. Guest of honor, Dr. Farhat Mantu, Executive Director, Medicine Sans Frontiers. Dean, Faculty of Medical Sciences, Senior Professor Aloka Patirana. Deans of Faculties, Dr. Varuni Tennakon, Chairperson, and members of the Research Committee, Faculty of Medical Sciences, colleagues and friends. I am privileged and humbled by this unexpected but singular honor, especially as I have always considered myself a physician and a teacher, but never really a researcher. I thank the Research Committee of the Faculty of Medical Sciences for this invitation and hope I will be able to do justice to their confidence in me. Growing old, ladies and gentlemen, is inevitable, and with it comes infirm. Aging works through many different pathways to increase our risk of diseases and their outcomes. Lifestyle changes and medicines are therefore essential to keep these diseases under control and to reduce their complications. The last decade saw Sri Lanka progressing from a lower middle income economy to an upper middle income one. With these economic changes, there had been drastic demographic changes in our country. The older adults, that's over 60 years of age, who accounted for 12.4% of the population in 2012, stands at 16.7% today. in 2041, two decades hence, 25% of our population will be over 60 years. And most of us here tonight will be that fourth person. The very old, that is those who were more than 80 years of age, who accounted to only 1.8% of the population today, will increase to about 5% of the total population in 2041. Many of these older adults will be living in the community, either with their children or with their families, or increasingly alone. While these demographic transitions resemble that of a Southeast Asian or Asian economy, they have taken place in the presence of economic instability and crisis, taking the country to level of bankruptcy today. It is on this background of demographic transition and economic instability that Sri Lanka continues to battle the dual burden of infections and non-communicable diseases. Now, infections are expensive to treat, but they are treated, and most of the time we can cure them. Not so with non-communicable diseases. These need long-term management to keep the diseases under control and also to reduce their complications. The incidence of non-communicable diseases, which is around 5% when a person is 25 years of age, increases exponentially once a person is over 35 years and reaches around 60% after 70 years of age. Sri Lankans will therefore live longer with disabilities that are inseparable from aging and financial insecurity, live with more diseases and take more medicines, and therefore will use a significant proportion of the limited healthcare resources we have at the moment. At this point, ladies and gentlemen, permit me to introduce you to Mr. A, an 82-year-old diabetic with a reasonable blood glucose control and managing quite well with his family in the community. He had developed a leg ulcer, and because of the pain associated with it, he had gone to see a doctor. At that time, he had told the doctor that he was finding it difficult to fall asleep. The doctor who saw him cleaned his wound, gave him an antibiotic, a painkiller, and a drug to make him fall sleepy, a benzodiazepine, and told him to go and see a surgeon because the wound was a little bit more than what he was happy with. The surgeon saw him, again cleaned the wound, continued the same antibiotic, changed the painkiller to something much more milder, and gave a drug to make him fall sleepy, and also added an anti-epileptic drug, carbamazepine, probably because he thought he had diabetic peripheral neuropathy, and that was what was causing the pain. 4 days later, Mr. A was wheeled in by his son because he was feeling extremely drowsy, was finding it difficult to walk, and was slurring when he was speaking. So when I saw him, apart from being unusually drowsy, there was nothing abnormal to find. Now, Mr. A would just doze off in his chair, wake up when you try to wake him up, and answer very correctly, but would go back promptly to sleep. So going through his medicines, I realized that he was actually taking medicines from 2 prescribers. In addition to what the surgeon gave him, he was also on the drug to make him feel sleepy, the sedative, that the medical officer has taken because nobody had told him to stop it. So this combination of 2 benzodiazepines, which you should anyway not take, and the anti-epileptic is enough to put any one of us asleep. And this is more so with Mr. A because Mr. A is older and therefore he is more vulnerable to the effects of these medicines. So ladies and gentlemen, the older people are the most who will derive the maximum benefit from medicines, but they are also at a greater risk of adverse events. So with Mr. A began my journey into exploring medicine's use in older adults. A crucial aspect in prescribing to anybody is to give them the right medicine for their condition. Now, prescribing is considered inappropriate if we don't give the right medicine, that's a prescription omission, or if we give a medicine that is harmful or is not indicated, that's an inappropriate medicine. Collectively, these are called potentially inappropriate prescribing. The word potential indicates that, yes, there is a possibility of causing harm, but not whether it actually does so, but the risk is there. And it also highlights the fact that prescribing is essentially an individualized process and tailor-made to the individual person. With limited physiological reserve and age-related changes in drug handling, the older adults are at a higher risk of drug-related adverse effects. And the potentially inappropriate prescribing is more likely in these people because they have a lot of diseases and they take a lot of medicines. It was a problem globally and recognized in the early 1900s, 1990s actually, and because those countries, the developed countries, were experiencing an explosion of older adults in their population. Now, the worldwide prevalence ranges from 15 to 44%. The range is because of the criteria they use, and of course, depending on where the samples of the patients are collected to ascertain this prevalence. The criteria that we use can be either explicit or implicit. And there are many studies globally looking at this problem of potentially inappropriate prescribing in the older adults. However, when I first started to look at this problem and wanted to know whether there was any data from Sri Lanka, this was way back in 2012, there was nothing. There were no papers about what medicines the elderly take, and therefore obviously nothing about whether the medicines were appropriate or not. Therefore, we conducted a descriptive cross-sectional study to identify the common long-term medicines prescribed to older adults and to see whether the medicines given were appropriate or not. We conducted the study in 3 hospitals and selected patients who were over 60 years of age. Now, 60 was taken as the cutoff because that's the retirement age from the public sector. And we looked at patients who were attending medical and diabetic clinics because that is where people who are on long-term medicines are generally managed. And from their records, we extracted the most current prescription and also looked at some of the investigations that were done over the period of 1 year before we collected the data, and of course, the diseases that they have. We determine the potentially inappropriate medicines by using what are called Beers criteria, a set of explicit criteria. We selected Beers because that had been there from 1990 and was widely used. And to look at potential prescription omissions, we selected ischemic heart disease as our key disease because that was the one that was causing the most number of in-hospital deaths in Sri Lanka at that time. And we had to use the American Heart Association guidelines to identify the required medicines because at that time Sri Lanka did not have any up-to-date guidelines. So there were 1,114 patients in our sample and 62.7% of them were on treatment for multiple diseases. 68% were taking more than 5 drugs a day. Interestingly, we noticed that despite a female predominance of more than 50% of a sample, only 5.39% of them were taking calcium supplements. And that was funny because we expected it to be higher because this is an age group which is quite vulnerable to osteoporosis. 12 out of the 34 potentially inappropriate medicines and classes recommended to be avoided in older adults were noted in our sample. And 12.5% of these people who had a confirmed diagnosis of heart failure were on medicines that could have worsened their clinical condition. Despite the absence of any documented contraindication, we found that some of the recommended medicines that needed to be given to patients with ischemic heart disease had not been prescribed to these patients. Interestingly, these are relatively inexpensive medicines, medicines that were even at that time in the Sri Lanka's essential medicines list and therefore in the hospital's formulary, which meant that they should have been available to the patients. And more importantly, these were low-cost interventions that have been proven to reduce the mortality and morbidity of atherosclerotic cardiovascular disease. The main limitation in our study was that we had excluded patients who were on medicines for psychiatric illnesses and cancers, and these are also two very important categories of medicines because they also cause problems in older adults. And of course, we found it difficult to assess some of the criteria because the documentation was uniformly poor. We published our work in the Asian Journal of Nursing, Pharmacy and Medical Sciences. Now, we realized that Beer's criteria had some limitations. They do not identify the underuse of helpful medicines, which is why we had to look at guidelines, and that was cumbersome. It doesn't look at the duration of medicines to see whether it's appropriate or not. And of course, Beer's was developed for a North American healthcare system, which is totally different from what we have in Sri Lanka. So therefore, we repeated the same exercise using a separate set of explicit criteria. We used Stop Start. Now, Stop Start, as the name implies, has both. It tells you what medicines should potentially be stopped and what medicines should be potentially started. Although it had been developed for Europe, Stop Start had been used much more widely in other settings. So for this study, we selected a sample from a hospital and included those who were attending psychiatric clinics as well. And we also selected a sample from a community, different from the hospital catchment area, because we wanted to see whether we can see some private sector prescriptions. However, the sample we got from the community was very small, so therefore I will be presenting the data as a whole. So we had 468 patients in our sample. 72.9% were on treatment for multiple diseases, and more than 50% were taking more than 5 medicines a day. We analyzed 468 prescriptions, which included 2,841 medicines, and 97.4% of the prescriptions had at least one or more potentially inappropriate prescriptions. The prevalence of potentially inappropriate prescriptions, taking the total number of the medicines, was 16.4% in our sample. We found 171 instances where medicines that may cause problems had been prescribed to these older adults, and when we looked at them, we found that these were medicines that can worsen age-related changes like confusion, falls, and constipation, and so on. There were 296 instances where drugs which were known to cause benefit in the older population had not been prescribed. And these two were technically medicines that were in the cardiovascular and the endocrine system, which can have a significant impact on the outcome of the disease and patients' general well-being. Again, our study was hampered by incomplete documentation because most of the crucial biochemical information was not documented in the clinic records of the patients. An interesting thing we found was that 8.5% of our sample from the community did not have any health record with them, despite the fact that they were taking medicines. They knew they were taking medicines, but they didn't know what they were taking. They had some idea about the diseases that they had. Now that poses a problem, especially in Sri Lanka, because we do not have a proper referral system and the patient can go from one prescriber to the other. And when you go to the next prescriber, this person will not be able to tell the prescriber correctly the medicines that he or she is taking. And that is a problem which needs to be looked at, especially because these are a vulnerable population. We published our work again in the International Journal of Clinical Pharmacy. Now, when we used these criteria, one of the major limitations we had was the fact that they had been developed for healthcare systems in developed countries. So therefore, the medicines they were telling us to avoid as potentially inappropriate, some of them were the only ones we had. We didn't have an alternative. And similarly, some of the medicines that they said to start, we couldn't do that because they were expensive. So therefore, we set out to develop a set of explicit criteria specific for Sri Lanka to assess medicine's appropriateness in the elderly. With permission from the original authors, we used TopStart version 2 as our base document. And based on our experience with the previous studies, we reviewed and flagged criteria which we considered as unfeasible for Sri Lankan settings. And to use the Delphi consensus, we identified a panel of experts who were from both the public and the private sectors, who had an idea of what the systems were like, and academic pharmacists, so that we could go for this Delphi consensus with a broader group. They were entrusted to assess all the criteria in TopStart version 2, including what we had flagged, and they were asked to base their final recommendation on the validity of the criterion in principle and taking into consideration the relevance to Sri Lanka. We conducted 3 Delphi rounds, and the final criterion we selected had 100% consensus. At the end of it, we had reworded 25 criteria to improve clarity. We had removed 11 because they were either not feasible in our setting or they were medicines that were not registered and available in Sri Lanka, and so on. We split one start criterion into 2 because we wanted to assess 2 different factors, and added 1 new start criterion based on Sri Lankan systems that we know of. The final modified stop-start criteria for Sri Lanka had 105 indicators, 70 stops, and 35 starts. And this work is published in BMC Geriatrics. We are now completing the validation of these stop-start criteria for Sri Lanka. The findings looks promising. We probably need to do some more work on that, and we will be presenting our findings in the near future. Ladies and gentlemen, despite being prescribed an appropriate medicine, unless the patients have access to that, it is useless. Accessibility is defined as a medicine being available at a price affordable to the person at a healthcare institution of his or her own choice. This is more important for people who with limited mobility and reduced financial resources. There were previous studies done in Sri Lanka which looked at the availability of essential medicines, but they had been done in one healthcare institution or a region and extrapolated to Sri Lanka. So therefore, we conducted an island-wide survey to determine the availability and affordability of essential medicines needed to treat non-communicable diseases. The survey was conducted in all 9 administrative provinces. It was the first time the northern and the eastern provinces were surveyed in any way in this type of a study. And the final sample included 109 pharmacies, both from the public sector and the private. We identified 11 common non-communicable diseases covering cardiovascular, respiratory, neurological, endocrine, rheumatology, the common ones that older people have and for which they are taking treatment, and 50 medicines, 50 essential medicines that are needed to treat these diseases. And 30 of these medicines are what we call stock items, which meant that they have to be available at all times in the healthcare institutions. So from each facility, we collected data on the availability of these essential medicines. And from the private sector, we collected data about the availability of an originator brand or the innovator and the prices. We defined availability into different levels and considered more than 50% as acceptable. Affordability was calculated based on accepted methods, and we defined affordability as that the drug would be affordable if 1 month's supply could be bought with 3 days' wages of the lowest paid unskilled government worker. We found that the availability of the selected essential medicines was more than 50% in all 9 administrative provinces and in both public and private sectors. But the lowest availability was seen in the outdoor pharmacies of public hospitals. The originator brands were not widely available. Sri Lanka categorizes her public healthcare facilities into levels based on the services that they are expected to provide. And depending on these services, the medicines that they are sent will vary. We found that the availability was not uniform in the public sector pharmacies, and 11 of the essential medicines we surveyed had very low availability. Now, when medicines are not available in the public sector, people have to buy it from the private pharmacies. And if the resultant out-of-pocket expense is unbearable, that could lead to problems with compliance. And therefore, we looked at the medicines' prices in the private sector. In 2013, 38 of the lowest priced generics were priced at less than 10 rupees a tablet or a capsule. And if lowest priced generics were bought, 1 month's supply of 31 individual medicines would cost less than 1 day's wages. A month's supply of single or multiple medicines to treat common diseases like high blood pressure, diabetes, or ischemic heart disease were affordable, even to the lowest paid worker. However, if they had to get insulin or inhalers, they were not affordable even as lowest priced generics. Now, if the patient had multiple diseases like diabetes, hypertension, dyslipidemia, and ischemic heart disease, then it was not affordable to buy some of the medicines to the lowest wage earner. Of course, it's needless to say that originator brands were unaffordable to many people. We published the bulk of our work in the BMC Public Health, and the cost analysis was given as an oral communication. Ladies and gentlemen, let me now share how we see what we saw. Our work shows that potentially inappropriate prescribing is a problem in Sri Lanka too. It is undetected and something that we are not consciously aware of. We found the prevalence of PIPs in our studies comparable if the studies had been done from patients attending general medical clinics like what we did. However, it was actually quite higher than when the studies had been done from patients attending special geriatric clinics. And this highlights the need to consider elderly as a special population and give them that little bit of extra care that we would need when their medicines are considered. Our work shows that explicit criteria are useful to identify potentially inappropriate prescriptions so that we could flag it to the clinicians. However, it is not meant to replace prescribing, which is a clinical call and a judgment-based one. For explicit criteria to be useful, they need to be cognizant of the healthcare systems and medicines availability of that country. And they must be reviewed regularly in keeping with the changing healthcare demographics. Beers and Stopstat have undergone multiple revisions, and each revision brings in new information, which is useful when we apply these criteria to our patients. Our work shows that most medicines were available both in the public and private sectors, but at times not where it was most needed, because most of our people, especially those who are socially disadvantaged and economically strained, would go to the public healthcare facilities. They were affordable to the majority, provided lowest price generics were bought. In 2022, we have expanded the essential medicines list so that most of the healthcare facilities would now have more medicines. Technically, they should have. And 2022 sees the dollar at 356 rupees now and rising exponentially. A bankrupt nation will need different approaches to ensure that essential healthcare is provided to all her people, and especially to those who are socially and economically disadvantaged. Prescribers in the coming years will have no option but to give what is available, and that might be a low-price generic. We will have to disregard sometimes our concerns about the quality of these medicines and know the limitations because we do not have data on their quality. So can we get out of this? I believe we can, because with careful selection and procurement and using good quality generic medicines, even within these existing budgets, most of the medicines that the country needs could be purchased. Ladies and gentlemen, when these two pharmacy undergraduates walked into my office way back in 2012 and told me to supervise their study, I was very ill prepared to do so. As I said, I was never really a researcher in that sense. It was a steep learning curve for the three of us. We went on with our work. When I look back at the original paper, I can see so many flaws with a little bit of knowledge which I could have improved. And obviously, it was rejected by most of the top-level journals. We finally published it free of charge on an online journal, only to find that it was in the Beale's list of potential predatory journals. Despite being in the Beale's list of a potential predatory journals, until we did the other work, that was the only published data we had about medicines used in the elderly from Sri Lanka. That paper paved the way for me to do a lot of other work subsequently, and we learned from there and moved forwards. Of the multiple aspects that are involved in prescribing to elderly, our work has looked at only one, and there are so many other areas that we need to think of. We do not know why potentially inappropriate prescriptions take place. We need much more qualitative data, in-depth analysis of prescriber practices. We actually don't know the harm these potentially inappropriate prescriptions can cause. We know they have the potential, but we don't know whether they actually cause these problems. And for that, we need longitudinal studies. We have absolutely no data from Sri Lanka about medication adherence in older adults. And we also don't know how medicines behave in very frail and older adults, those who are over 80 years of age. So much more to be done. We have very limited data on medicines availability and affordability. Hardly anything about cost. And that becomes crucial in the coming months, because if we are to give patients what they need to take, we have to be aware of the prices, their availability, and affordability to ensure the optimal medical outcomes. We need research, therefore, into key areas considering the changing socio-economic and demographic factors. We need collaborative research because medicines used in the elderly involves a lot of stakeholders. It's not only the prescriber, they are just one part of it. So many others like the caregivers, the medicine dispensers, people who are managing elderly homes, so on and so forth. So you need collaborative research. We need working groups looking at these issues on a long-term basis. It is important that we link our research findings to practice so that the prescribers are made aware of what we find in our research, and the policymakers to understand the limitations of the policies that they make. Merely saying that drugs are available in all healthcare institutions is useless if a patient goes there and finds that the medicine is not available. Very few of us here tonight, if any, will see the dawn of a new century, where Sri Lanka will be a country of old men and women. We need to plan, and we need to plan it now, especially because we have been given this demographic window of a sizable working age population. This demographic bonus is not going to last because our age dependency is again increasing exponentially. It is only by planning and being ready that we can be ready to treat the most vulnerable in our land, socially and economically disadvantaged, getting old, living alone. The work I presented tonight, ladies and gentlemen, is a collaboration between many. There are many in my group, and they come from diverse backgrounds. They all brought in different expertise, and it's the collective work that I have had the privilege of presenting to you tonight. A very special thank you to Nitushi, Ruini, and Dr. Hemantha Benaragama for sharing their expertise in different aspects, making me realize that prescribing is just one part of the whole picture. A very special thank you to Uchita, Samira, Sumeda, and Gangani, who trusted me, even when I wouldn't have trusted myself to supervise a study. Together we made this journey, and I hope the journey has been enjoyable to them as it has been to me. It's a very special moment, especially when your own faculty asks you to deliver an oration. So on a personal note, I would like to thank my two-member cheering squad and support Janak and Lahiru for all what they do, mainly for being with me. I know it's not been easy, but thank you very much, two of you. You are appreciated and loved much more than you ever know. And to the two people who made it possible for me to stand here before you tonight. Without them, I wouldn't be here. Finally, ladies and gentlemen, I know practically all of you here. You've been with me in this journey from 1995. We have grown up together with a faculty which was very young at that time. And I'm immensely glad that it is to you that I'm delivering this oration. Thank you very much for being here and for your patient listening. Thank you.
Thank you very much, Madam, for your insightful and extremely timely oration and for giving us all a reality check that we all needed. And I think most of all, for leaving us with much to reflect upon as we leave this hall tonight. Thank you for the hope you gave and for the shift in thinking that you narrated that I'm sure left all of us gathered here tonight ignited and inspired. Thank you very much, Madam. I would now like to take this opportunity to acknowledge the presence of Dr. Farhat Manto, the Executive Director of Médecins Sans Frontières, MSF South Asia, who is our guest of honor this evening. I would like to take this moment to invite Dr. Farhat Manto on stage to speak a few words.
Hello. After hearing such a nice oration, I'm not sure how much I will be able to hold your attention. But to start with, I'm extremely privileged to be here today among all of you. And I'm going to go back to the basics. And I asked myself, why do I want to go and start and talk about the basics? And you will get to hear it in a minute or so, why I say so. But before I go there, I would really like to thank Professor Olokwa. I have to make sure that I have your names right, because otherwise my team is not going to be happy with me. Dr. Varuni, Dr. Nilanka, am I right? Yeah? For all the support and collaboration that you have offered us. And it's not that these three have been demonstrating extreme leadership, but there is a big team behind them. So thank you everybody who has made it possible that we are here today. And it's a privilege to be here because I have been reading about this university and the history of the university. And it makes me very, very humble to stand here in front of you and talk to you and share something about my organization that I belong to. We heard about evidence-based medicine, how it prepares us for future, and what a beautiful oration, and how you expressed it, helping and making us aware that we need to think about future. Science, what a beautiful name. And I'm sure all of you know it's derived from a Latin word scientia, which means knowledge. And when my colleagues, Dr. Bishmaraj, Akansha, and Helen, spoke about the collaboration with this university, I went online to do a bit of research to see who our academic partners are going to be in Sri Lanka. And if I recall right, I looked at your motto, which said, among all that arise, knowledge is the greatest. So then I told myself, what a beautiful thing that we have science and an institution that believes in knowledge manifesting through a day that we are going to have tomorrow. And this conference for me is a symbolization of that. Usually, MSF or Doctors Without Borders is an organization that would be primarily treating patients and treating patients in places which are either impacted by a war or a conflict or areas where there are populations that are neglected and are excluded. Those exclusions can be economic, political, ethnic. So all these locations where we work, our teams, our medical doctors, nurses, paramedical staff, on a daily basis have to improvise. These are really resource-poor settings, and sometimes not even resource-poor settings, just because of the fact that the country is at war or the region is unstable, they lack the very basics of infrastructure to enable medical professionals to operate. In such situations, on a daily basis, our team improvises, tries to find solutions. Sometimes in an OT, it would be a luxury if you would have a proper lighting system. If you are in a bush, it would be a privilege if you would get somewhere an X-ray. So what we do is like all that experience that our field staff gathers in the field, that they would like to share with the rest of the world. So for us, these days, the scientific day is actually aimed at bringing that learning, both successes and also challenges and sometimes failures, to different people across the world, inviting academia to look at it, to see if there are similar locations around the world where medicine can be expressed in the same manner. So through a very, very rigorous process, an abstract-driven day, which is specially curated with an intent that we learn from each other, that is what we aim for tomorrow. So this is a day which is being kind of led by an editorial committee that looks at all the abstracts, makes sure that we are talking about evidence-based medicine. We are looking at a very thorough ethics review in making the selection, choice of the abstracts that we present to anyone around the world. And why do we do it? Because we believe that sharing knowledge is extremely critical, and especially because more and more we are recognizing that diseases don't have borders. COVID has proven to us that it was not that we could only look at in our backyard and not worry about the country border, next country. And that is one of the reasons we believe that we need to share science. We need to make sure through talking about science, we also learn from different people, different academic institutions about things that can benefit patients at large. So these days for us are intended to bring that aspect which improves the quality of care for our patients. So what I would like to say is like, please, we have lit the flame and do not stop it. Let us make sure that we all contribute and keep continuing talking about evidence-based science. We talk about research that is based in scientific rigor, has all the ethical aspects taken into consideration. We learn from each other, and we keep on making sure that the misinformation that is around is tackled by pure science. So with these words, I would really like to thank the university giving us this opportunity to be here, and looking for very active participation from all of you. Thank you very much.
Thank you very much, Dr. Farhat Manto, for your valuable words. We appreciate you being able to make it in time, just in time, as we wrap up tonight's proceedings. With that, ladies and gentlemen, we have almost reached the conclusion of tonight's proceedings. An event of this caliber and magnitude could not have been possible if not for the hard work of many individuals. I would now like to call upon Dr. Nilanka Pereira, the Secretary of the Research Committee, to deliver the vote of thanks.
Senior Professor Aloka Patirana, Dean of the Faculty of Medical Sciences, Dr. Farhat Mantu, Executive Director of MSF South Asia, Professor Chandini Manikatunga, orator, and all distinguished guests. I quote the famous singer Jimmy Dean, "I can't change the direction of the wind, but I can adjust my sails and always reach my destination." Unquote. The organizing committee of this conference had to adjust the sails to steer the ship forwards amidst unprecedented challenges. And here we are today at the ceremonial inauguration of the MSF Asia Scientific Days, an international conference on medical sciences 2022. We would not have reached the destination if not for the support and efforts of many individuals. Ladies and gentlemen, it is indeed my pleasure to propose the vote of thanks on behalf of the Research Committee of Faculty of Medical Sciences. First and foremost, let me thank our chief guest, Senior Professor Sudhanta Liyanage, the Vice Chancellor of the University of Sri Jayawardenepura, for the guidance and constant encouragement. Thank you, sir, for gracing the occasion despite your busy schedule and commitments. I would like to thank Senior Professor Aloka Patirana, Dean of the Faculty of Medical Sciences, for the unwavering support. This conference would not have been materialized without your help at every step of the way. I would like to express our sincere gratitude to the guest of honor, Dr. Farhat Mantu, Executive Director of MSF South Asia, for joining us today. We are indeed honored by your presence. Moreover, we are grateful for collaborating with us in conducting the scientific sessions despite the challenging situation of the country. We acknowledge the MSF team, Helen O'Neill, Strategic Advisor, Dr. Bhishmaraj Srivastava, Strategic Medical Lead, Akansha Arora, Executive Manager, Sachin Singh, Director of Fundraising, Garvit Nangia, Neha Saluja, Deepak Bhatia, and all MSF members who worked tirelessly to make this conference a reality. We hope MSF will continue to join hands with the Faculty of Medical Sciences in future endeavors. I would like to congratulate Professor Chandini Manikatunga for delivering an excellent oration and sharing your work over the years on the care of older adults. The scientific sessions to be held tomorrow as a hybrid conference would not have been possible without the significant contribution of our speakers from Sri Lanka and overseas, who will join physically or virtually. Let me thank Dr. Maria Guevara for delivering the keynote on the timely topic of climate change and impact on health, and all the speakers of the symposia and panelists for sharing their experience. We acknowledge the moderators and the chairpersons of the sessions for contributing to this conference despite their busy schedules. I wish to thank all the oral and poster presenters for sharing their valuable research in our conference platform, and all abstract reviewers and judges for their commitment. Let me thank all academic members of the faculty who supported and encouraged us constantly. Thank you. A special note of acknowledgement to the non-academic administrative staff in the university and faculty for stepping out of their boundaries to help organize this conference. Mrs. Varnika Amaratunga, the Assistant Registrar, Mrs. KTC Priyangani Burza, and Mrs. Manoja Kumbukage, Assistant Burza, and their teams are deeply appreciated. I would also like to thank a few individuals who enthusiastically helped us along the way. Mr. Asanka Pereira and Mr. Chamil Kumara for IT and web support, Mr. Vasanta Manavadu, Mr. Nishanta, Mr. Asanga Karunaratna, Mr. Abhay Singha, and Mr. Atula. Thank you, and we hope you will continue to support the future activities. A special note of appreciation to Impress Events, our event management company led by Mr. Nalina Manasingha, for the outstanding contribution. Your positive attitude and enthusiasm make this conference possible. Thank you. Our service providers, SLT management staff, for providing internet connection at a very short notice, tasty caterers for providing refreshments, need a word of appreciation. Let me thank Dr. Kalani Kulatilaka for the excellent comparing tonight. Students of our faculty have always been a strength to us, and we would like to acknowledge their valuable contribution for the cultural performance you are about to witness, for doing photography, videography, ushering, and joining hands with the organizing committee to make this conference a reality. No one can whistle a symphony. It takes a whole orchestra to play it. Let me thank all the members of the research committee for standing together in these times of uncertainty and contributing in many ways to successfully organize this conference. A special word of appreciation to the chairperson, Dr. Varuni Tennakon, for leading from the front and paying attention to detail. Dr. Tushari Disanayaka, conference secretary, for shouldering the massive burden of the event. Dr. Aruni De Silva, the conference assistant secretary. Dr. Shehan Silva, the conference treasurer. And Dr. Prasangika Senaviratna, conference assistant treasurer, for the unstinted support and dedication. The constant advisors and encouragement of all members, namely Dr. Sithara Disanayaka, Dr. Saraja Vijayasekara, Professor Shamini Pratapan, Professor Guvanili Yanage, Dr. Madhura Jayawardena, Dr. Tushara Matthias, Dr. Sanath Mahavitanage, Professor Shalindra Ranasinghe, Professor Manori Gamage, and Dr. Shamini Adhikaram is humbly acknowledged. Finally, let me thank all of you who joined us today in person. I always also invite everyone to join us tomorrow for an exciting academic experience. Hope you have a pleasant evening. Good night.
Thank you very much, Madam. With that, ladies and gentlemen, we wrap up the formal proceedings of tonight. Next on the agenda is a lineup of cultural performances by the students of the Faculty of Medical Sciences. I would like to invite all the dignitaries seated at the head table to kindly take your seats in the audience to enjoy the rest of the performances. The students of the Faculty of Medical Sciences have always taken a keen interest in mastering the fine arts. Over the years, they've taken the center stage, not only here at the university, but have taken our alma mater to national and international stages. It gives me great pleasure as an alumna myself to welcome these talented youngsters to this esteemed audience tonight. We first have a musical performance lined up for you. Music truly transcends all boundaries, and it is able to take you on a journey within a snapshot. The next performance is also by a group of very talented undergraduates of the Faculty of Medical Sciences who will bring to you a medley of songs of multiple languages across many genres, starting off with an all-time hit, pop hit of everybody's beloved Ed Sheeran, and then moving on to a fusion of songs of Sri Lankan traditional and contemporary numbers by two of Sri Lanka's most popular musicians, Bhatia and Santush, and in between, a touch of traditional folk music added in. Ladies and gentlemen, while our musicians get ready, let's give a big hand and welcome the orchestra. Satira Dimantara on violin, ladies and gentlemen. Let's give a big hand. Netra Dizoiza on guitar. Netra Dizoiza on guitar. We have Shehan Dinuk on percussions. And we have Naveen Fernando on the keyboards. With mesmerizing vocals to be brought to you by Kavinga Disanayaka, Yasanjit Manavadu, and Ivoshini Madara. Ladies and gentlemen, the stage is yours. Let's give a big hand.
I found a love for me. Darling, just dive right in and follow my lead. Well, I found a girl, beautiful and sweet. I never knew you were the someone waiting for me. මගේ සිහිනේ ඔබයි එංගුනා මගේ සිහිනේ ඔබයි අනුරාගද හැසිලා තනියහනේ නොවේ ආදරේ ආදරුසුම දැසෙනු ඉපිටේ පොසත් නායව වාරෙක පැහැදරන් ඉතිසිල් නරලොව වහන එක මොවද දෙමින්නල් ලාහි තුන්දික වැසදරමින්නට වාදුම් දීනට රන්කුරහන් මල සේවා සුදුුණු ඔබේ වත බෝමා දැකරමන් සිත
What a breathtaking performance. I'm sure they deserve another round of applause. The members of the audience found it very hard, I saw, to stay put and not get on their feet, with their feet tapping all along. I think you did absolute justice to these timeless classics that most of us have grown up listening to over the last 10, 15 years. And the renditions were breathtaking. Well, very well done. Next up, ladies and gentlemen, after that mesmerizing musical performance, we have traditional dancers of Sri Lanka, which will be brought to life on this very stage. Traditional dance of Sri Lanka is considered as one of the most ancient dance styles in the world that are preserved to date, and has always been able to showcase the pride of Sri Lankan art to the world. This performance is a combination of Kandyan, Pahatarata, and Sabaragamuwa dance traditions. Let's give a big hand, ladies and gentlemen, and welcome the junior-most students of the Faculty of Medical Sciences. They are brand new, and this is most probably their first performance to an esteemed audience of this nature. Dilki Ganepola, Chaturya Vijayendra, Kavya Fernando, Yelani Hettiarachchi, and Dinani Vikramathilaka, the dancers of the Faculty of Medical Sciences, on stage. Ladies and gentlemen. I think the energy we felt on stage was palpable to each and every one of us in the audience. Truly, they set the stage on fire. Ladies and gentlemen, let's give another round of applause. Thank you for that brilliant performance and for having radiant smiles across their faces despite how difficult the dance moves were. What a fitting finale to this magnificent night. Ladies and gentlemen, with that, we conclude the proceedings of the ceremonial inauguration. Thank you for being a wonderful audience, and we hope to see you tomorrow as we engage in a vital discussion and share knowledge on a multitude of diverse topics chosen by veterans in each field of medicine, all at one common forum. We hope all of you would have a successful conference tomorrow, and with that hope, we conclude tonight's proceedings. Please rise for the national anthem. Thank you, ladies and gentlemen. Please remain standing for the ceremonial procession to leave the hall.